Hi everyone, Beth Sager with the Lex Local, and today we are here in the office of Jodi Eipper-Mains, who is a psychiatrist here in town. So tell me about yourself.
Sure. So I trained in the Boston area. First I did medical school, but that was at University of Connecticut. I guess because I'm a glutton for punishment, I did a PhD as well. So I did an MD and a PhD. I don't use the PhD, but it's in genetics. And then I came for residency to the Boston area. So I trained at, it's now defunct, but the Harvard Longwood Psychiatry residency training program, which had me at Brigham and Women's Hospital, Beth Israel, Faulkner Children's, and Massachusetts Mental Health Center. So that's 4 years. And that was 2013 to 2017. And then I did a medical psychiatry fellowship that's called Consult Liaison Psychiatry, and that was at the Brigham as well. Brigham and Faulkner. Followed that with a couple of years working on an inpatient unit at the VA hospital. That overlapped with COVID. And I got a little burned out and transitioned to outpatient, primarily telehealth with a telehealth company. Then I had a kid and was on maternity leave. And when I got back, I kind of I guess I just wanted more autonomy and more like control over my schedule. And so I decided to open a private practice. And so I started here basically in March of 2025. So,
pretty new to town.
So I live in Bedford, so not new to Lexington, and my husband grew up in Lexington. So, yeah, definitely not new to like the area, but new to here as a business.
Right. Yeah, kids will do that.
Yeah.
They'll make you want to like have a different sort of mindset on career, right?
Yeah, for sure.
More 100-hour weeks. So do you have a specialty?
So I am a general psychiatrist. I see adults, basically mostly 18 to 65. I do have a couple of older patients. And I focus primarily on like depression, anxiety, OCD, attention deficit. But one area that I find particularly interesting is women's mental health. So when I was doing my medical psychiatry fellowship, I was embedded in the maternal fetal medicine program at the Brigham, and so that's like the high risk pregnancy group, working with the OBs, helping patients with preconception consultation, planning around their psychiatric meds, and support during pregnancy. So I see people now in my outpatient practice similarly, I talk to them about if they're thinking about starting a family or they're already pregnant, like what do their psychiatric meds mean, for them, for the baby, and support, postpartum. And then also women in the like perimenopause, menopause transition.
That's big.
Yeah. It's becoming much more like talked about, which I think is great.
It is good.
Yeah, and there are starting to be more kind of medical interventions that can be helpful, because I think
before,
for a long time, it was like,
this is a big secret.
You just have to deal with it.
Right? I know. It's like, really? It's a lot to deal with. So.
It is. And not everybody, obviously everybody's experience is going to be slightly different, but at least people are talking about it now. So.
No, I agree. I know. There's a group in town that's really sort of pushing all kinds of seminars and stuff about it. So
it's good. I feel like knowledge is power.
Right. No, I agree. I agree.
And also just acknowledging things kind of validates what people are going through.
Like this is
even
normal.
If there isn't that much you can do.
I know. Some of the symptoms you're like,
well, they're
was
vague.
this supposed to happen? Right?
Because people just haven't talked about it for so long.
I know. So. It's kind of like when you have a baby, they don't talk to you about a lot of things, right? And then you're like, oh my God, no one talked to me about this. So, So that's interesting, sort of. So if you were on like depression medicine and you got pregnant, do you still continue to take your drugs? I mean, is that?
Yeah, it obviously depends on the specific medications, but the vast majority of the medication prescribed for, run-of-the-mill kind of depression and anxiety, those are your typical like selective serotonin reuptake inhibitors, things you've probably heard of like Prozac, Zoloft, Lexapro. Those are very, very safe during pregnancy.
That's good to know.
millions and millions of women have taken them,
Right.
pre-conception, during pregnancy, and in the postpartum period. There's one medication, Paxil, that we steer clear of.
Yeah.
But yeah, the overwhelming majority of meds that we prescribe for those kinds of conditions are really safe. And we used to think of women as like incubators, and it was like, you're just gonna grow a baby, and then who cares how you feel?
Right.
And like, just grow it, take care of it, and like, nobody really was gonna check in with you. And now we actually understand that not treating depression and anxiety while a baby is growing inside of you is actually an exposure for the baby. Like, it's associated with babies being born prematurely or low for gestational, like low birth weight.
Interesting.
And that when you actually treat depression and anxiety, that those measures like improve. So now we kind of understand, you actually, as the incubator, need to be in a good mental space throughout the pregnancy, and very much so right before delivering, because all hell breaks loose after the baby comes out and you're not sleeping and you're trying to figure out how to keep a human alive and, all of those things. So that support during like the postpartum period is really important too, because your hormones are going wackadoo, and you're just not feeling usually at your best, to say the least.
Not that I recall. Yeah, not a good time. So, well, that's interesting. So, as a psychiatrist, you're the doctor that gets to prescribe drugs, though, right?
Yeah.
Right. So.
So I primarily do medication management. I do some supportive psychotherapy too. So if you want kind of more structured therapy, like cognitive behavioral therapy or dialectical behavioral therapy or acceptance and commitment therapy, things like that, someone like a social worker or a psychologist is much better kind of trained to, help you around that. But I do more like supportive, where I ask you about like your family and your job and kind of how all that stuff is.
Do you start at the beginning?
Yeah, when I first meet someone, I always ask them, if they're coming to me saying like, I'm struggling with depression or something, like, well, when did that start for you? Were you someone who struggled as a little kid? Did it not start till you were older? And we kind of go through all of that. And then as I meet them over time, more obviously comes out. But that initial appointment is usually around like 90 minutes. So we do cover quite a bit during that. So, but most people that I see, I'm doing a bit of supportive work, but and the medication management side of things.
Gotcha.
Cool. Yeah.
Is there anything else you think we should know?
Well, because I just started, I am taking new patients. So I'm actually able to see people really pretty quickly, which is good.
That is good.
Yeah. And I'm always available, just as consultation for people too. So I see plenty of people as like a bit of a one-off, where they're like, I want a second opinion, or, I've been seeing my primary care for this, and I just want to know if they're doing the right thing, that kind of thing. Okay. So always helpful to very happy to do that sort of.
Okay, and is insurance a thing for you, or?
I'm an out-of-network provider, so I don't contract with any insurance companies, but I provide what's called a super bill after each appointment, and that gives you, there's a lot of acronyms, but CPT codes and diagnostic codes.
Okay.
These numbers, basically, that you can submit to your insurance provider for out-of-network reimbursement. Nice. So I provide that for everybody. If you don't have out-of-network coverage, it is pretty expensive, but a lot of people get quite a bit back.
I see. Okay. Nice.
Yeah.